Okay. Hello, everyone. Welcome to the World Burns Week Global Webinar Series. My name is Siobhan Connolly. I represent the Australian New Zealand Burn Association, and I'm moderating today with Michael Sergio, who represents the ISBI, the International Society for Burn Injuries. So we have our World Burns Week, which is looking at a global collaboration of organisations representing burn care. We're looking at public health, advocacy and survivor support within this. And this is the week that we will be presenting these global webinar series. So I might get you to advance, please, Natalie. So an important thing is if you would like closed captions translated, please set it up on your system now. As you can see, if you go into your show captions and the captions translation, you can actually select the spoken language and your caption language. So please take a moment to set this up if you would like that for yourself. Thanks, Natalie. So this is day one. Ignore the fact that it isn't the 3rd of November, it is still day one. That's because we're straddling over different time zones. So day one is about preventing the burn for this series, and just quickly on the rest of the series, we do have 4 more sessions on preventing burns in children, preventing post-burn complications, preventing the chaos of mass casualty disasters, and also preventing isolation through community and connection. So there's a lot of array across prevention. It isn't just looking at the primary prevention, but that is definitely what we're focusing on today. So we're looking today at safe by design, so building burn-free communities, focusing on engaging and energising the community, including government, healthcare entities, lobbyists and other stakeholders to push for prevention legislation and provide examples of successful prevention programs and campaigns from around the world. So we're going to have a couple of great presentations and then we'll have time for questions. Now, when you're going to write your questions, please use the Q&A and not the chat. If you put something in the chat, it will get lost. So please write in the Q&A and we will be able to answer your questions after both of the presentations. So without further ado, I'm going to pass over to our first presenter, Dr. Barclay Stewart, who is the Associate Chief of Trauma and Burns at Harbourview Medical Centre, the Director of UW Program for Rural and Global Surgery, and WHO Liaison for the International Society for Burn Injuries. And he's going to talk to us today about lighting the way towards a global framework for burn injury prevention. Thank you very much, Dr. Stewart.
Thank you very much for the introduction and welcome everyone. We had a great session this morning and I hope we have some good questions in the Q&A for this one as well. As mentioned, I'm Barclay Stewart. I'm a burn and trauma surgeon at the University of Washington in Seattle in the United States, and I'm a global injury prevention and control practitioner by trade as well. It's really an honor to participate in the World Burns Week, and I'm excited to talk about how we can get on the same page and work with one another for a future without preventable burn injuries. Though our humanity unites us all across the world, the hazards we face from fire and burns are as varied as our kitchens, our homes, and our workplaces. Additionally, there are regional differences in culture, infrastructure, and conflict which shape the patterns and causes of burn injury around the world, and our prevention initiatives must address these. We also continue to struggle against the burns born of cruelty, like child abuse and neglect, chemical assault and acid attacks, and violence against women and girls, and to meet the lifelong challenges faced by those who survive them. Though we live and work within very different health systems, each with varying levels of organization and resources dedicated to burn care, we share the same goals: to make safety, treatment, and rehabilitation a right for every person, not a privilege of place or of income. Fortunately, even though our contexts differ, the risks of fire, burn injury, and the challenges of recovery are nearly universal and shaped by common factors such as poverty, crowding, and unsafe housing, social vulnerability and gender equity, lack of regulations and enforcement, particularly for building codes, and limited access to organized burn care. Despite this common ground, our efforts often remain fragmented. We work in silos, moving in parallel rather than in consort. We still don't know with confidence, for example, how many major burns occur each year or how many people die from them. Estimates differ by orders of magnitude between modeling studies, gold standard epidemiological surveys, and national registries. And despite this uncertainty, only a handful of countries operate even basic burn surveillance systems, active or passive ones, capable of tracking trends, hazards, outcomes. We do have a set of proven interventions with very strong evidence, however, like smoke alarms, thermostatic mixing valves, safer cook stoves, but there are many hazards for which evidence-based solutions remain limited or entirely absent. Most critically, even the best interventions mean little if they are not sustainable, scalable, and properly evaluated. Without implementation and rigorous follow-through, good ideas never become lasting impact. So like the blind men, each touching a different part of the elephant, we too are working within our own systems, hazards, and contexts, each holding a piece of the solution and all needing to come together to build a coherent global framework for burn injury prevention and control. But fortunately, we've been here before. The UN Decade of Action for Road Safety was launched in 2011 in response to the alarming toll of road traffic injuries, then causing 1.3 million deaths and up to 50 million injuries annually worldwide, with more than 90% of those fatalities occurring in low and middle income countries. The goal was to mobilize political commitment and coordinated multi-sectoral action to halve road traffic deaths and injuries by 2020. This has since been renewed through 2030 as part of the Sustainable Development Goals Target 3.6. One of the most powerful outcomes of the Decade of Action for Road Safety was the development of a truly global intersectoral framework, a shared structure that brought order and accountability to the once fragmented field working on road safety. It organized the work of hundreds of partners around 5 pillars: stronger leadership and governance, safer roads and vehicles, safer behavior among road users, and better post-crash care supported by robust data systems. This framework catalyzed real action, enabling countries to produce annual report cards that tracked progress and gaps in infrastructure, legislation, policy, and enforcement. These reports use standardized definitions of key policies and practices, allowing progress to be compared and monitored over time, with technical support from World Health Organization country offices and road safety advocates globally. Through this shared framework, the world succeeded in bending the curve of road traffic deaths, reversing decades of steady increase. And even when the COVID-19 pandemic tested every system, many countries were able to continue this vital work given the shared vision. While tangible gains were made, much work remains. Many countries fell short on their national report cards, and the overall 5% reduction in road traffic deaths was well below the ambitious 50% target set by the UN in 2010. And so here we are in the second decade of action for road safety, a renewed global commitment to finish what we started. When we talk about a framework, we're not talking about just bureaucracy. We're talking about a scaffold for coordinated, measurable progress. The Decade of Action for Road Safety showed what's possible. Shared goals and metrics helped more than 30 countries cut road deaths, preventing over 1 million fatalities. Burns need that same type of organizing logic, a global scaffold that adapts to every context and aligns around common principles. First, evidence-based and equity-driven. And that means that we use real data and focus on those most at risk, like women cooking over open flames, children near scalding water, and families living in unsafe homes. Partnership means that no single sector owns the problem of burns. Health, housing, energy, education all must work together. Accountability means that shared indicators can be used to track progress and not just promises. And above all, a framework must be responsive, flexible enough to address hazards from the cook stove burn injuries in Nepal to wildfires in California. In short, it gives us a common language and a shared vision, so progress anywhere informs progress everywhere. So appreciating the power of a single global framework for road injury prevention, we must now ask, what pillars and actions will support a world with fewer preventable burn injuries? Think about it. A collective strategy for burn prevention isn't beyond our reach, it's simply waiting for our commitment to make it real. The International Society for Burn Injuries unites professionals from more than 80 countries and works with the World Health Organization to advance burn prevention, care, and research. ISBI is now embarking on a global effort to create a comprehensive framework for burn prevention and control, and I'll share my email at the end with a QR code if you'd like to take part more fully in the process. Even with a framework to guide our efforts, there's no magic solution to advancing burn prevention. It starts with each of us and with our network of partners, burn care providers, patients and survivors, community groups, fire services, policymakers, and others. Identifying hazards we can change and those most at risk. The most practical way to improve data is to use what we already have, linking hospital registries or leveraging existing syndromic surveillance systems in emergency departments, like those that track febrile illnesses, diarrhea, and road traffic deaths. In places without robust data, we often depend on modeled estimates instead of actual ones. This figure comes from the Global Burden of Disease Study, the most comprehensive global data set available. It shows a sharp increase in burn incidents in 2015, which is almost certainly an artifact of missing or inconsistent data, not a true increase in injuries. To move forward, we must strengthen surveillance, connect existing systems, and use reliable data to design, evaluate, and sustain effective prevention programs. Fortunately, we don't need to reinvent the wheel. There are already successful interventions we can adapt to settings where our patients live and work. But we also know what works in one community may not necessarily work in another. Context really matters. That's why implementation outcomes like feasibility, acceptability, sustainability, and cost must be valued as much as effectiveness outcomes. And when we share results, we need to share both the impact and the process of how we got there so that others can build on what worked where we were. You can scan the QR code here to access our implementation science guide at the University of Washington. It's a quick, practical reference tool that can strengthen your approach to burn prevention. Around the world, prevention programs have shown that anyone from community advocates to burn centers to NGOs and policymakers can drive progress in fire safety and burn prevention. In the United States, a growing movement once paralleled major smoke alarm campaigns pushing to require home fire sprinklers in new construction, particularly multi-dwelling homes. The evidence was clear. Sprinklers save property, reduce injuries, and prevent deaths. Yet around 2010, more than a dozen states passed laws to limit these requirements. Yes, limit requirements for home fire sprinklers. Thanks to persistence of advocates like Amy Acton and the Phoenix Society, fire marshals, and the National Fire Protection Association, that tide turned. Today, California, Maryland, Massachusetts, and New York have statewide sprinkler mandates, and many cities and counties have followed. Most importantly, this local grassroots effort drove change in the International Code Council's residential fire code, proving that coordinated advocacy can shape national and even international standards. Dr. Bhupendra Sarma in Guwahati, India, showed us the true power of prevention led from a burn center. His team launched a multi-pronged program combining school-based education, community health promotion, and pre-Diwali social media campaigns, meeting people when and where they were at highest risk. They didn't stop there. They rigorously evaluated their work using an interrupted time series design with control communities all across Assam state. The results were quite striking. They had a 45% reduction in burn-related hospitalizations in Guwahati, while neighboring areas saw a 41% increase over the same period. This is what success looks like: locally driven, incremental, evidence-based, and scalable. Dr. Sarma's model shows that burn centers can lead prevention initiatives, and their impact can ripple far beyond the hospital walls. Quanakiem is an extraordinary nonprofit in Chile dedicated to child burn prevention, care, and research. For decades, they used their burn registry as a form of syndromic surveillance for firework-related injuries, documenting a recurring pattern of preventable harm during national celebrations. In response, they launched a creative public safety campaign with marketing experts, building broad community support. That momentum led to collaboration with legal partners to develop a legislative toolkit, ultimately resulting in a national ban on retail fireworks in Chile. Since then, several Latin American countries have followed their lead with pilot programs to restrict retail fireworks sales, traffic, and use, proving that data, advocacy, and persistence with some creative thinking can translate directly into life-saving policy. Our group at the University of Washington partnered with Acid Attack Survivors, Acid Survivors Trust International, a survivorship NGO, and human rights legal experts to conduct a global policy analysis of 140 countries. We examined the laws and regulations related to chemical assault, including chemical sales restrictions, legal protections for survivors, litigation strategies, and models for rehabilitation and reintegration. This collaboration brought together the voices of those most affected with the expertise needed to inform policy change, showing how science, law, and lived experience can align to prevent a particularly devastating form of injury and its sequelae. To maximize our impact, we have to think beyond the burn community. We must build a broad coalition that connects health, housing, energy, gender equity, and disaster sectors, and graft burn injury into movements already gaining momentum, from climate science to safe cities and maternal and child health. And just as importantly, we must advocate for domestic investment. Sustainable prevention can't rely on grants and goodwill alone. It must be embedded in national budgets, policies, and priorities. World Burns Week is a great chance to build a coalition of the willing, bringing together community groups, NGOs, and government agencies to amplify prevention efforts for burns. Collaboration doesn't have to start from scratch. Joining existing data initiatives and prevention programs is an easy way to engage now. The lessons from these partnerships can be used to create scalable models that work in diverse settings, turning shared learning into shared impact. We can go farther, faster by linking burn prevention to existing global health movements, just as HIV and maternal child health programs succeeded through alignment and not through isolation. We can graft our goals onto well-funded and visible agendas, advancing safer cook stoves through the social justice, indoor air pollution, and climate change movements as example, or integrating smoke alarms and fire suppression into urban and slum health initiatives, and embedding chemical assault prevention within broader efforts to address gender-based violence. When we align with momentum that already exists, burn prevention becomes part of something bigger and far more powerful. Wealth is rising in nearly every country, even as inequities within and between countries remain profound. This growing capacity gives governments new opportunities and responsibilities to invest in injury prevention and control. We can and should make the case that burn injury prevention is not just a moral imperative, but an economic necessity. These injuries cause measurable losses to the gross domestic product through lost productivity, indirect care costs, and property damage. Investing in prevention strengthens the social contract and delivers a clear return on investment. Numerous examples abound. El Salvador, for instance, increased tax revenue by 4% of GDP between 2005 and 2013, and directly invested that to cut child mortality by nearly 75%. Rwanda, in its efforts to rebuild after genocide, grew revenue from 3.6 to 13.4% of their GDP, reinvested into essential health services, and reduced mortality across many conditions, including road traffic injuries. These are powerful reminders that when countries raise and reorient domestic resources toward prevention and health, mortality falls, systems strengthen, and progress toward the Sustainable Development Goals accelerates. The same can be true for burn injury prevention. So across the world, our hazards may differ, from open flames and electrical burns to acid violence and industrial fires. But our goals are the same: to prevent suffering, to protect lives, and to ensure recovery with dignity. A global framework for fire and burn injury prevention can unite us all around shared principles while allowing each region to tailor actions to their own risks and resources. I've included this QR code with my email if you'd like to get involved in the ISBI's framework initiative. Submit your initial thoughts on key pillars and action priorities in that email, and expect to follow up in the coming weeks on how to participate more fully. And we don't have to do it alone. By leveraging existing global health movements, from climate resilience to urban safety and gender equity and health system strengthening, we can multiply our impact. Together, we can turn shared purpose into coordinated action and make burn injury prevention a defining public health success of our time. Thank you.
Thank you so much. Amazing presentation and lots of things for us to think about. And we will come back to you with some questions later. Thank you very much for that, Dr. Stewart. So I'm going to welcome our next presenter, so Kamal Fuyal. So Kamal is a Nepali professional actively engaged in social development, community health, and the revitalisation of traditional knowledge. His primary interest lies in people-led development and participatory action research. For the last 3 decades, he's been working with local governments and non-government organisations to develop participatory plans through the active involvement of local communities and other stakeholders. He led a community-led burn prevention project implemented in Nepal from 2017 to 2020, and he's going to talk to us today about that. So I'll ask you to share your slides for us, please, Kamal. Lovely, thank you.
Hello, namaste, everyone. I'm Kamal Fuyal. I'm from Nepal. Actually, I have been affiliated with Interbonds as a member since 2013. Interbonds, in partnership with local NGO named Sagun, started a participatory burn prevention project in Nepal from 2017 to 2020. So today I would like to share a key learning and experiences from that project. So to talk about burns in Nepal, these burns are the second most common type of injury in Nepal. Actually, there is no national survey done on burns in Nepal. So if to talk about burns data, we have to rely on the report published by the Ministry of Health in 2009. So it also indicates that burn is really a neglected issue in the health sector in Nepal. So that report says approximately 55,000 burn incidents occur every year. And out of that, 21 people die annually and 5% are left with disability. In this context, Interbonds and Sagun, the local NGO, we started one project in Nepal. Actually, we named it as Community-Led Burn Prevention Project because we believe that without the initiation and active participation of the local people and local stakeholders, no social change is possible. So believing this, we started this project and we named it as Community-Led Burn Prevention Project. So we selected 3 municipalities for comparative study because Nepal is divided, into 3 major geographical regions: mountain, hills, and Tarai. Because most of the burn cases, we find in hospitals, because I'm also working with hospitals, burn treating hospitals in Kathmandu. So from data, we find that more than 60% of burn cases come from the Tarai regions. So we selected 3 municipalities for comparative study. And, these 3 major objectives set by the project. First, we wanted to conduct a survey with active participation of the local people and local government themselves. And we also set an objective to develop a strategic plan for burn prevention, then enhancing capacity of local stakeholders for the sustainability of burn prevention process. So regarding the process, we, from the very beginning, we started working with local government. Just to share with you, there are 3 layers of government in Nepal. We call it local government, municipality government, also it's called. Then we have provincial government and national government. And local government is responsible to take care of all the development activities at the community level. And they have, they can make decisions, they can make plan by themselves. So we spend time, meeting and discussing with local government in 3 municipalities, to have immersion with them. Then we identified local partners, local stakeholders, mainly local government and health institutions. We have health posts in each and every community, which provide basic uh, health services to the local people. Then also schools, we worked with youth clubs and women cooperative especially, because in our project areas in 3 municipalities, we found that women cooperative are very active. Like they have covered about 96% of the households, means 96% of households have membership in those cooperatives. So cooperative, women cooperative especially was one of our major stakeholders. Then in the beginning, we shared the objectives of the project. We discussed a lot about burn issues in Nepal. Then we oriented them on, the importance of burn prevention things. Then having discussion and having immersion, very close immersion with local stakeholders, we conducted a survey to find out the burn situations in the municipalities. For that also, we worked together with local health workers and social workers, especially local government provided us this support. They provided their social workers and other youth members to involve in the survey. Then actually these are, you can see some data, we found from the survey. Like in the 3 municipalities, the 3 municipalities means in the mountain municipality, about 1,400 households are there. In the municipality in the hills, about 3,500 households are there. And in Tarai municipality, about 6,000 households. So there we found 92 severe burns occurred between 2013 and 17. We did this survey in 2017. And scald and flame burns are the major cause, like 80% of the total burns because of scald and flames. Then 63% of the burns occurred in kitchen. So the kitchen is the main place where burn takes place. We found that. And 39% of the burns are among children, 5 years and below. And 7.6% were left with disability, which is higher to national data. National data is about 5%. And we found that 91% and more, of the burns occurred in economically poor families because of their poor housing condition, because of these poor electrification systems. We also had one questions, asked during the survey to know about the knowledge level on bonds related issue of the respondents. And we found that, sorry, this is not 29, it's mistaken. 79% of the respondents have no knowledge on bonds. For example, what are the causes, and if they have bonds, where to go for treatment. So they were unknown on this issue. Then after the survey, we prepared the report and we widely shared the outcomes. We organized a workshop with local stakeholders and discussed about the survey outcomes. We organized community gatherings in more than 100 small gatherings, and we discussed about the survey outcomes. And we also shared this with the health-related organizations in the municipality and outside the municipality, especially with the provincial government. Then after that, we organized planning programs. So, after letting people know about the burn situations, then we asked them, how to go ahead. And our stakeholders, they were prepared to go ahead for prevention. Then we organized planning exercises, especially in 3 levels. First, we did many planning exercises at the community levels with women, with youth members, with children, also with indigenous institutions. Then second level, we organized planning exercise with health institutions at the municipality level. And FCSVs, these female community health volunteers, they are very active to provide health-related services at the community level. So we also did planning exercise with FCSVs. Then finally, we brought all the exercises outcomes at the municipality level, and we sat together with elected representatives and health office staffs, then finalized the burn prevention plan. And major activities developed during the exercises were actually this, in all levels, they came up with the training, as one of the major activities, like burn prevention training. So we organized training for health workers, from the health institutions. We covered almost 100%, health workers in this training program. Then we did burn prevention training for FCSVs, female community health volunteers. Then we also organized training for women cooperative members, social workers, and school teachers. And we did orientation workshops with elected representatives, because they are the key people to make decisions and take the lead for any development programs at the municipality level. And we also organized a burn prevention education program in schools, especially for high school students. Then organized many village level gatherings, village level orientations to discuss the things for burn prevention. So we covered almost 70% of the households. So at least one member from 70% households participated in this kind of orientation program. Then also developed some awareness raising materials for training for health workers and FCSVs. We also developed, this is posters on burn preventions, and all the contents we developed from the village level planning exercise to develop these posters. Actually, they suggested this kind of pictures can be helpful to aware people for burn prevention things. And this is flyer. Then we also printed a calendar and with this burn prevention related informations, messages, so that people can have that, in their room and watch every day. And we developed, this is burn prevention handbook developed for FCSVs and social workers and also school teachers. Actually, this was prepared in the course of working together with the local peoples and other local stakeholders. This is handbook developed for burn preventions, and these days, this FCSVs and health workers, they have been massively using this to aware people for burn prevention. And this is a primary burn care handbook for health workers. It was developed while working together with the health post staffs. And we also gave an orientation to the health workers for using this handbook properly. And one magazine was published quarterly, which included burns-related information, articles, interviews, and also case stories written by the local people and health workers themselves. We have been publishing this quarterly since 2017. And major outcomes of the project, we can say that, of course, at least we could conduct a survey, detailed survey to assess the burn situations in 3 municipalities in Nepal. And yes, we could reach 70% of the household, because earlier I said that from the survey we found 79% of the households did not know anything about burns. So this is why we targeted to reach 80%, but from this project we could reach 70% of the households of the municipalities to raise awareness. And also enhancement of capacity enhancement of female community health workers and health workers, social workers it could be done. It can be, yeah, we can say that this is one of the major outcomes of the project. Then this IC materials developed, and especially, we could establish a strong network linking local government with burn treatment hospitals, because before the project started, the survey showed that most of the people, about 80%, 79%, they didn't know, when they have this burn problems, where to go, what to do. So yeah, we could establish network, and there with the two major burn treating hospitals in Kathmandu. And I remember that these two municipalities, they had a formal agreement with hospitals for free treatment for the people in those municipalities. When they have any burn related problems, the hospitals would provide quality treatments at free of cost. That kind of agreement could also be done between the hospitals and municipality governments. That was another achievement of the project. And finally, in 2020, because actually survey showed that there were about 92 cases in 3 municipalities, severe cases of burns. But in 2020, we found that there was no burn incidents in 2 of the project municipalities, and only 1 incident occurred in 1 municipality. So yes, this is one of the major outcomes of the project and the main outcome. And local government incorporated burn prevention program in their regular annual plan. This was, and because we believe that without the local government, because local government is the main body of the government to take the lead of the development programs at the community level. So if this, whatever we do, this bonds, other development programs, if it cannot be incorporated with their annual program, then it cannot be continued, because there are many cases. This burn prevention efforts were made for 2-3 years at the community level, and once the project is phased out, then everything will stop. So we could work together with local government. And one municipality, they also allocated budget in their annual plan for the continuation of burn prevention movement. So yeah, burn prevention is possible. Yeah, we got the evidence, but for this, community themselves should take the lead. And we also realized that once the local people realize the need for the change, and they will take the lead. So we spent a lot of time, especially in the beginning. We spent a lot of time with the local people, local stakeholders, to discuss and interact about the need of burn prevention. And we also organized some visits of these local government representatives and women cooperative representatives and school representatives. We took them to Kathmandu and let them have interactions with the hospital workers, and also we organized their visit to burn ward and they could interact with the burn patients. So doing all these things, yeah, it helped them to realize the need of burn preventions. So and also, we found that FCS, in Nepal's context especially, these female community health volunteers, there are about 60,000 female community health volunteers in Nepal. They are the key persons because they are from community itself. So they have direct and day-to-day communications at the household level. So working together with the FCSBs and the social workers can be very effective to share bonds related informations, at the household level. So it was very helpful for us to succeed the project. And yeah, as I said earlier, this is also lesson we learned, integration of burn prevention movement into regular plan of the government. This is very important, and this is actually lacking at the national level because there is no bonds related policy made at the national level so far. And these evidences and success stories can influence further change, especially in planning and policy making level. When we started sharing the outcomes of our project with neighboring municipalities and also I mean also with the health related institutions in Kathmandu, then they started asking our for providing technical support. Like for instance, actually we had a sharing program with Kathmandu Metropolitan City health sections. Then about our project outcomes. So Kathmandu Metropolitan City requested us to provide some technical support for burn preventions in Kathmandu. So we organized training for health workers. We trained about 200 health workers and more than 500 FCSPs of Kathmandu Metropolitan City. And besides that, we have had, I mean, this neighboring municipalities where we conducted our project. They have asked us to expand this burn prevention things in their municipality as well. So, but I want to say this not as a project only, but burn prevention. We use the term burn prevention movement so that even after the project is completed, we want the local government and local stakeholders continue this process on their own. So, but this limitation is, the experience we have had from this project. Actually, we did this in rural municipalities and semi-urban municipalities. Maybe it cannot be generalized. It cannot be generalized in the urban municipality. So this is the limitations. And this burn prevention movement, especially in the rural community in Nepal, is very necessary because, because of geographical conditions, there are many communities very far from the center. And there are only 7 or 9 hospitals which provide burn treatment, and out of 9, 6 are located in Kathmandu. So the working together with the local people for burn prevention is very necessary in Nepal's context. So I would like to stop it here, and yeah, your comments and feedbacks are most welcome. Thank you very much.
Thank you so much, Kamal. That was an amazing presentation. Really appreciate hearing all of the things that you have said. And just a reminder to everyone who is online, please put your questions into the Q&A and we will certainly ask our presenters. We haven't got anything as yet.
We do not have any as of now. Yep.
Yeah. So I thought I'd kick it off by starting with you, Buckley, if I can. One of the comments you made was to graft burn prevention into current sort of projects and that sort of thing, which I think is an amazing analogy in regards to burns and grafting. So obviously the Nepal project that Kamal was just talking about is something that could go across. I suppose one of the problems is I'm a burns nurse, and when I was on the floor looking after the patients, I always thought, how can I do something? How can I start something? And I suppose what's the first step that you would say for people out there who are listening?
Yeah, and Dr. Fuyal can probably pick up on this too, given his experience. I think one of the first things is that concept of building a coalition. I mean, none of this happens, particularly as Dr. Fuyal explained in his presentation, and with one group or one cadre. It really is a group effort. Number 2 is find things that are really important topically, locally. There are big issues all around the world with gender equity, with indoor air pollution. The amount of burn injuries in Nepal from cooking and unsafe cook stoves, as well as heating and warming and lighting, frankly, again, often either near the inside of the home or inside of the home, all align with important burn injury prevention opportunities. Importantly, a lot of the work that's done to change, for instance, cook stoves in Nepal and elsewhere has really focused on the indoor air pollution aspect. But the amount of time that women and girls spend getting biomass fuels as opposed to being in school or earning a wage or having an appropriate social role. Additionally, the risks associated with traditional biomass stoves and even improved cook stoves and more recent low quality, non-standardized LPG stoves, all of these issues are around the same sort of concepts, and ensuring that burns is represented with those changes and how we work toward improved cooking and lower indoor air pollution, I think is a good example of how that could be started. Dr. Fayal, any thoughts with your experience?
Thanks, Barclay. Yes, Kamal, I was going to come to you. So, yeah, obviously what you've done is absolutely amazing, and it has, built up within Nepal and hopefully getting that continuity. But how would you recommend that somebody goes about a similar sort of project in their area? Because there's a lot of places that need to do these sorts of things.
Yeah, actually, the most important thing we have realized, because I'm doing this kind of thing for the last 3 decades, before burn preventions, of course, I worked with, for the last 30 years, I have been working with local people and the local government. So most important thing is, without they realize the need for the change, only imposing project from outside is not possible, because there are, the thousands of projects done in Nepal. Actually, in Nepal, these NGOs, do not have good image. Because there is a very strong critic that they prepare everything outside, they prepare the plan, budget everything outside, and go to community to have their participation only in implementation things. So based on this experience, and actually we started everything from the very beginning with local people's participation, and we did so many things. I remember one case, like in the mountain municipality for this burn prevention things, we interacted a lot with these elected representatives. And I remember 2 members, they were so reluctant to participate in this process, but without their participation in decision making, we could not do anything. So what we did, we organized their visit to Kathmandu. We brought them to Kathmandu and organized interactions with 2 hospitals, burn treating hospitals, right? Then when they listened to the doctors, medical workers about the severity of burns, then we organized their visits to, interaction with the burn patients. And I remember one, this elected representative, so he was asking us for allowance, this and that, to come to Kathmandu, but we don't have that provision, right? Then, after interacting with burn patient, and that member, the same member, came to me and asked, can I give some money to that patient? Because during the orientation, the doctor had said, you cannot provide anything to the patient, right? Look, that and big change, that was big change. We realized once we could organize their interactions with the burn patients, once they see the realities, this attitudinal change can be possible. And after they return back to the municipality, then they've made policy at the local level, then it went very smoothly. So main thing is that let us start with locals from the very beginning. Yeah, of course, this is a little hard, but yeah, of course, possible and also important.
Yeah, absolutely.
Yeah,
that's a great point. Sorry. Sorry, Michael.
I do see 2 questions now in the Q&A.
There are, yeah.
The first one is for Kamal. is the rural project continuing since 2020? Is the reduction in burn cases continuing over the last 5 years?
Yes, actually, there in one municipality in the Tarai region in Janakpur, we found 3 very severe cases in 2023. That is electric burns. But this fire burns and scalp burns significantly reduced. And we also realized that this electric burn is little, not in control of local people, because especially they got connection with what do you call that? A high tension line. Uh, yeah, but these 2 municipalities in the mountain and in the hills very much reduced. In the municipality in the hills, no severe burn incident so far. After 2020.
Very good. The next question has a similar flavor. It is maybe for both of you, but Kamal first. What strategies do you use to make the initiative sustainable over time in the local communities once you have finished the interventions?
Yeah, of course, from the very beginning, we were very clear that, whatever we do, after phasing out, it must be continued by the local government. So we planned this from the very beginning. And as I shared, these 2 municipalities integrated burn prevention program in their national annual plan. But the problem was in one municipality, like they have elections every 5 years. So we worked with one team for 5 years. They were convinced, they integrated the plan, but the next elections, the whole team was changed. This is also one big question for us, because the previous team, we spent together 5 years, 4 years, right? But the new team, then this is also a question to, actually we are discussing on this. Of course, if the national policy include it in their annual plan, I mean, this national government, once national government include this, then all the local government must do that. So now lacking is this must be integrated in the national plan of the national government.
Dr. Stewart, a comment from you on this sustainability?
Yeah, I mean, just to add a couple of things. I mean, one of the key things that we have found over the years is institutionalizing these sorts of interventions through existing systems. So, for just again, take the Nepal example, since it's been so well described by Dr. Fuyal, the ideas of bringing this sort of education built into the school curricula or to fire service outreach programs, encounters with maternal and child health encounters, for instance, ways that it can become part of the community rather than through the prevention program itself. And then certainly, again, as Dr. Fial described, the train-the-trainer models, which Interburns has done fantastically over the years to ensure that you have a growing cadre of people that can train and teach not just the next generation, but certainly for broader geographic reach. And then I'd probably say lastly, just thinking about future financing mechanisms. How do things like this get funded over the long term? And there's lots of opportunities for cost sharing and innovating with the private sector, for instance, in the cookstove world. LPG alliances and such really want people to buy LPG stoves, and the safer they are, the less hearsay of incidents of burn injury, the better they're going to sell, which also happens to be our priority too, with better, more safe stoves. So there's lots of ways to think about cost sharing and betting financing mechanisms into a sustainable future for these interventions.
Thank you.
Yeah, that's a great point, because the cost is one of those big things, particularly with governments who want to push back against jumping on board with all of that. There was another comment from Deborah for you, Kamal, who it was around you managed to get a lot of responses to your initial survey. How did you go about getting those numbers of responses initially?
You mean how we selected the respondents, or am I correct?
Probably a little bit of both. So selecting them and also getting them to agree. So it's always good to identify who you want, but sometimes they won't agree to be involved. So I think probably a bit of both.
Okay. Actually, these 3 municipalities were selected, having discussions with the concerned authorities, of course, and also, we wrote a proposal. This is the process we have to follow. We wrote a proposal and submitted in NHRC. This is National Health Research Councils. Actually, we had interactions for for a couple of times. Then we got approval from NHRC to do survey in these 3 communities. And after that, of course, we had a series of discussions with every local government has health sections, and we had a discussion with health sections, regarding the survey and also about the project. And health sections, they have actually all the health posts at the municipal level. They are guided and by the health section. So this is the process we followed. Yeah.
Excellent, thank you. So we are approaching the end. So I'd like to thank you both for your presentations and your insights. It's been amazing. And the good news is that they are recorded so that other people can actually access them, because we know that some people do struggle with the different time zones. So there are just a couple of final slides. The first thing to note is that if you would like a certificate of attendance, you can scan the QR code that is just about to come up, which I haven't seen just yet. There it is. The good news is if you don't get to scan this right now, when you log off, when you finish with this, you will actually get sent to a screen that will take you to the feedback survey as well. And we do have a couple of other QR codes for the upcoming webinar series and also the local activities. But I just wanted to say again, another really big thank you to Dr. Stewart and to Kamal, both of you, for giving up the time to talk to us and for giving us some amazing information about what we can do particularly for primary prevention, and try and reduce the number of burns. I always like to say, let's put ourselves out of a job, and that's really what we're trying to do by doing really good burn prevention. So thank you so very much, and thank you all of you who attended. Thank you all.
Thank you.